to the 7th session of the National Commission to Address Racism in Nursing's 4th ECHO series. This series has a focus on health equity. Whether you have been involved in previous ECHO sessions or are new to this space, we are so excited to be here and hope this interactive learning series is a place for you to find guidance and support. This program is brought to you by the National Commission to Address Racism in Nursing, a multi-organizational collaborative of leading nursing organizations examining the issue of racism within nursing and motivating all nurses to confront systemic racism. This is an 8-part series. You will earn 1.5 continuing nursing education units for attending today's session. Please stay to the end to complete your evaluation and receive the CNE certificate. Today's topic is balancing the scales, moving towards health equity. Before we go over our ground rules, we wanted to quickly orient you to some of the features of the new iEcho platform that we're using. You can review session materials within your iEcho account in the content section outlined in green here within each session. Presenters will upload their slides and any other relevant materials here for your use. There is a conversations tab found within the discussions tab circled in yellow here. This is meant to be a place where you can engage with other participants in the series. Please note any questions directed to ANA staff and/or anything time sensitive should be sent via email to commissiononracism@ana.org. If you are having trouble finding any of these features, please also email us at commissiononracism@ana.org. Please pay special attention to our ground rules as we learn and engage with each other today. Note that we will be turning off the chat during the didactic portion of today's session, and you will still be able to message a co-host directly if needed. This is a brave space, and discussing racism and health equity is difficult and uncomfortable, especially for those directly impacted. Discussions such as these can serve as a trigger. We ask that you maintain respect for everyone joining us today. Please stay on mute until it is your turn to speak. Listen intently and respond thoughtfully. Please be present and limit background distractions and multitasking. Take advantage of the virtual features available via Zoom. We encourage turning your cameras on if you can and using the chat box or when it's available and raising your hand features to communicate with the group. But please remember to mute your microphone when others are speaking. We also want to respect participant privacy. Please do not disclose names or other sensitive information shared. If you share a scenario involving a patient, do not provide any PHI during today's call or any of the ECHO sessions. Feel free to send a direct message to ANA ECHO if you have technical problems during today's call. So our speaker today, Julia Chan, she just graduated nursing school earlier this month from Penn State University and will be taking the NCLEX very soon. Most of us know what an exciting and stressful time that can be, but we are so proud of you, Julia, for finishing school and also for agreeing to be here today and accepting our invitation to present. When Julia was meeting with us, we assured her that this is a loving space and a space where we learn from each other, and that her experience as a student is an integral part of our continued conversations about racism in nursing and health equity. So we want to give her a special warm welcome, and I'll turn it over to Julia Chan.
Thank you so much, Kara. Very excited to present to all of you. I am very, very nervous, but I'm just going to share my screen and get started with the presentation. So as Kara mentioned, my name is Julia Chan, and my topic today is balancing the scales, moving towards health equity. So I just wanted to go over some of the objectives for today's session. So first of all, it's discuss the current demographics of nursing students and their nursing education with identifying where changes can be made to help students build a stronger foundation of diversity, equity, inclusion, belonging, and anti-racism. And also finally identifying strategies to help support nursing students through their nursing school journey. So I know there was a quick introduction about me, but before I get started, I wanted to let you guys know who I am, and why this is something I'm passionate about. So as she mentioned, I just graduated from the Penn State Meese College of Nursing, May 4th, and recently just moved to Durham, North Carolina, where I will hopefully be taking the NCLEX soon so I can start working at Duke University Hospital in their cardiothoracic surgery step-down unit in July. Some background, I was born and raised in Hong Kong, but I moved to the United States for college. And I am a first generation college student and also the only person in my whole entire family to be in healthcare. But besides being a first generation college student, I was the first person to also go halfway across the world for college with no family in the United States. And I most lately served as the 2023-2024 National Student Nurses Association representative on the commission as the Breakthrough to Nursing Director. And just a little disclosure, I will be talking about my own personal experiences during nursing school, and all the statements I make are my own and do not reflect Penn State or NSNA. So kind of just going into my journey of how I got to be here and why this is something I'm passionate about. So in this picture, I am obviously very, very little, but these are my grandparents who, my grandpa is Mongolian. He immigrated to Hong Kong from Mongolia when it was a trying time in Mongolia that he doesn't like to talk about. And this is my grandma who sadly passed away from cancer when I was 5. But they are my two biggest inspirations and the reason I became a nurse and why I'm passionate about DIB. And this is when I graduated high school, when I finally realized that throughout the experience of being in high school and doing community service, I realized nursing was truly something I wanted to do, because I'm sure, as a lot of you, if you're not familiar with Hong Kong is one of the most expensive places in the world to live in. But even it being expensive, it doesn't mean that there isn't poverty. There aren't people who are struggling to just meet their daily needs in Hong Kong. So I spent a lot of my time volunteering with these individuals, and how they helped me, how they inspired me to get into nursing was I helped educate them with their medications, because sometimes it was hard for them to access healthcare even, or even just daily necessities and whatnot. So they are the people in Hong Kong, and my family are my biggest inspiration of why I became a nurse. And something else to note is that I did graduate high school and start college during the COVID-19 pandemic. So this was also a very big challenge for me to navigate, on top of moving to the United States from Hong Kong with no family and not knowing anyone. So this is me my sophomore year, just got my scrubs. We all had to go around campus and take our photos. But this was kind of when I started getting really into the nursing or pre-professional organizations at Penn State. The same time I started college, Dr. Sheldon Fields, who is Penn State's Associate Dean for Diversity, Equity, Inclusion, also joined Penn State. And it was during this pandemic where I became very close to Dr. Fields, who I am so proud to call my mentor and one of my biggest supporters. But it was during the times of COVID-19 where I found myself as a minority nursing student really struggling at a predominantly white institute and not having the support that I felt I needed to navigate, one, nursing school, but also navigating being in a whole different country on my own. So Dr. Fields was always there for me, and he always encouraged me to join, pre-licensure groups and just to find community within the nursing school. And so this was when I first started my professional organization journey. This is the Student Nurses Association of Pennsylvania, and it was my sophomore year where I ran for and became the Nominations and Elections Committee Central. And so this really helped me meet people across the state who are passionate about the same things that I do, but also get to know more about nursing itself, and not just bedside nursing, but there's so much things out there with nursing that you can do. And this was kind of the pivotal point in my journey where I realized advocacy, diversity, equity, inclusion was something that I really wanted to dive deep into, because as my role as NEC committee, I slate the people who decide to run for positions on the board. And something that I did was encourage students from all walks of life to run, and still to this day, some of these students are on the board and have continued to be on the board and make very positive changes in the community in Pennsylvania. And so from being on the state board, I joined the national board my junior into my senior year, and I was the Breakthrough to Nursing director. And if you are not familiar with what that is, it basically includes everything and anything related to DIB and anti-racism. I look at how to support students supporting their communities, look at different policies and what advocacy could be done to help students, support them through nursing school, and also as they transition into their career. And so that's kind of led me to where I am today, because through being on this board, I was able to serve as the NSNA, the first NSNA representative for the commission. So that was a very exciting opportunity. And finally, that's led me to graduation. Recently graduated, and then obviously I will be working at Duke. So that's just kind of my little backstory on how I got to this point and why I've been invited to do this presentation, which I am very excited to do. So moving on to the actual presentation part. So as I'm sure everyone is familiar, people call America the melting pot of cultures, because America is simply so diverse. There are people from everywhere and every cultural background in the United States. And this is kind of a chart showing the projected growth of the different different races in America. So as of 2018, the total population in the United States was predominantly white. And by 2060, the population will still be predominantly white, but then the numbers of that is less than 50%. So that while they are still the majority, there are many more other races that are becoming more and more predominant in the United States, such as Hispanic races. And so this is important to know when we look at the next slide of statistics, because as a diversifying country with the growth of individuals, the nursing profession should reflect the population of our patients. And besides nurses, that also means our nursing students should reflect that race ethnic profile. So this is some current statistics that I was able to find on the NA website, and also just through research of different papers. These are the current statistics, and I'm highlighting that with nursing students, their demographics do not have to be reported. It is reported by school, and also the demographics of nursing schools obviously vary dependent on geographical location. So this is just a quick comparison. So nursing students, 64.2% of nursing students are white, 11.3% are Asian, 10.8% are Black or of African American descent, 9% are Hispanic or Latina, and 0.4% are American Indian or Alaskan Native, and 4.3% are unknown or 2+ races. And then when we look at being a registered nurse, 75.4% of nurses are white, 3.6% are Asian, 23.6% are Black or African American, 7.5% are Hispanic or Latino, 1.4% are 2 or more races, and 0.6% are American Indian or Alaskan Native. So as we all know, nursing is a predominantly white female career, but that doesn't mean that this has to be that way. It was in the past, but with the way things are changing now, there are obviously an increase in diverse nurses. But still, we look at this, we compare these statistics and we wonder, how do we go from having 64.2% of which is a majority of students, nursing students being white, go up to 75%. That is a drastic jump. And if you look at all the numbers for the other races and ethnicities, besides Black or African American, where it goes from 10.8% of nursing students to 23.6%, all these other categories drop in percentage. So how do we go from having a program that has 11.3% of nursing students to only having 3.6 Asian nurses? What is happening in the moments from transitioning to school into the workplace? What are we missing? Are these students, minority students, not getting the support they need? What barriers are they facing? Financial, maybe it is travel to get to clinical. Those are also barriers that may contribute to nursing students not being able to become registered nurses, because I'm sure, as all of us know, nursing school is not an expensive thing to pursue either. Because yes, we get our return on investment, but to invest so much in the beginning can also be very difficult for many students and their families. And so we want the whole idea of this, to balance the scales, is to see what the current issues are in schools that prevent these minority students from becoming nurses. So we want to bridge that gap so that the nursing workforce can reflect the growing population of America. And so now we're gonna just look at so these few pictures are representative of the three integral parts of nursing school, which is the lectures, the classroom setting, the simulation, lab practice settings, and finally clinical settings, going into the hospitals or going into the community to work with individuals, and how all of these three components intersect and help us become nurses, and also help us become more culturally aware nurses. But first of all, I want to talk about accreditation. So all nursing schools have to be accredited by either CCNE or ACEN. And essentially, this is the accreditation process, if you are not familiar, is where an independent, non-government peer review of a nursing program by an established authority is conducted, and they review all aspects of a program to determine whether or not its graduates are qualified to pass the RN examination and practice as RNs. And so there are set guidelines, or they're online, where you can take a look of what they kind of expect from nursing schools. And when I was doing my research for this presentation, when I typed in diversity, there was barely any mention on a 37-page document about guidelines of what they're looking to accreditate a school for. It glosses over diversity, and then you can barely find any mention of equity, inclusion, belonging, or anti-racism. So that was a glaring issue that I saw, because even though nursing schools do not have, they do not follow a standard curriculum, they just have to be accredited. Schools set their own curriculum. So what they teach their students, yes, has to align with the accreditation in order for students to take the NCLEX, but there are no guidelines on how schools should tackle discussing diversity, equity, inclusion, belonging, and anti-racism. It is entirely up to the school, the faculty, in how they want to address this issue. So this discrepancy has led to students getting different experiences. And talking to other peers of my own, some students have had many opportunities to learn and develop their skills in DIB and anti-racist thinking, but other schools have had little to no education on this. So how are we expected to join the workforce and work with such a diverse population if we are not really taught this in schools, or it's not even brought to our attention? So first, we come to talk about classroom and lectures, because this is the first kind of interaction nursing students have with the workforce. So obviously we have lots of textbooks, But something that is very noticeable, and this is not just for nursing, this is throughout any medical field, is that there is a lack of representation in textbooks. So if you were to see, let's say Kawasaki's disease on a white individual, it would be very prominent red spots all over their skin. And the books would show a picture of this. But that is all they show. They don't talk about how people in Black or African American descent, this shows up a lot more. It doesn't show up as red, it's smaller white dots. And so it could be really easily misdiagnosed or missed even. And so that is one of the issues, is that there is not enough discussion about what diseases look like on different individuals and different cultures, and lecture PowerPoints themselves are taken from parts of books and previous presentations. They gloss over discussion about minority groups. They kind of talk about, oh, it might be sickle cell disease is more prominent in African Americans. And that's just because it's genetics. And that's it. They don't talk more in depth about it, which kind of leads to the point of there being no discussion regarding relationships between racism, discrimination, and health, even when they describe disparities. And this is this is topics we need to talk about. We need to bring to attention, because there clearly is a relationship between all of these things. It's not something that is standalone. And this prevents us from achieving health equity, because they're not even talked about, which leads us to the practice and simulation. And so nowadays in nursing school, most schools have simulation labs, and we have mannequins who are pretty effective in kind of allowing us to practice our skills. But something that I've also noticed is that the mannequins we have in school, some of them are not very diverse. We might have, at least at my school at Penn State, we have one arm that is darker skin for us to practice IVs in. But in terms of our general full body mannequins, all of them are white. And even the patient scenarios that we are given are very homogenous in terms of there's not much diversity in what we're looking at. It is always a standard, a 80-year-old white male patient. It had past medical history of heart failure, et cetera, et cetera. We don't ever look at things that might be pertinent to minority populations. And even if there is a use of standardized patients, which is rare, that is the only time we do get to interact with people who are of different skin color, different ethnicity. And this is that bringing diversity into practice, into simulation, is integral, because this is a safe space for students to practice, make mistakes, and learn, and where they develop their skills. So if they can't develop their critical thinking skills relating to DIB and anti-racist practices in a safe space, how are they able to do this in the clinical setting, which is what we're talking about next? And I put real patients in quotes, because we are told to treat our simulation patients real too, but it's obviously not the same, because they are not talking back to you. They are not living and breathing. This is where we get our hands-on experience, and we are exposed to so many different individuals with different diseases and health processes. And this is where we as students learn how to communicate with patients and other healthcare professionals, and where we develop our own critical thinking skills while recognizing our own implicit bias, because we can talk about it as much as we want in lectures, in simulation, but you can't really do that until you are kind of face to face with your own implicit biases. And so something that I've seen, and talking from personal experience, I went to Penn State, a predominantly white institute. There were maybe about 5 or 6 other Asian students in my program. And in part of the notes, the resources, is a testimony from a classmate of mine. and he is the only male African American student in our program of 150 students, the only one. So he kind of talked a lot about his experiences, but we found that where we got a lot of our kind of exposure to DIB and kind of how to address things was meeting mentors in professional organizations such as NSNA, NBNA. And these are also resources that are not discussed enough about in nursing education because they focus so much on training you to and teaching you to pass the NCLEX. These pre-professional development organizations are missed, but it is in these scenarios where they bring up the discussion about diversity, equity, inclusion, belonging, and anti-racist practices because these students are truly advocates and they are passionate about, balancing the scales, making healthcare more equitable for everyone. And something that I have personally found is that I first joined SNAP and NSNA through the encouragement of Dr. Fields, and because I wasn't able to find kind of people who understood my background and where I came from and the experiences I was going through in nursing school in my peers. So I had to find that on my own and outside. So from our view, my slides are, so just kind of talking about some next steps. Encourage and support discussions around diversity, equity, inclusion, belonging, and anti-racism. Be a mentor to students and advocate for your nursing students. If they come to you with any issues or any suggested changes, support them. But as always, be aware of your own implicit biases because it may impact how you treat your students, but also how you treat your patients. But you might not even know that. And also, learning is a continuous journey. Learn from the people around you, learn from people who have been nurses for years, learn from your students because they bring a perspective that you don't have, which kind of goes into listening to your students. Our voices are important too. We are the next generation of nurses. And so it is important that our voices are heard as well, which is why they've so graciously invited me to present to everyone today, because sometimes we don't hear about how the transition from nursing school to becoming a nurse is like, especially in around such topics. And another big thing is to call out the inappropriate practices and to educate those around you if you see or hear something that doesn't sit quite right with you. And so this kind of leads us to our scenarios, which will be in our breakout rooms. But you are a nursing student from a minority background who is completing your clinical rotation in a busy urban hospital. One day, while on duty, you notice that there is a lack of representation of minority patients in the hospital's promotional materials, such as posters or brochures. You also observe that some patients from minority backgrounds seem to receive less attention or are not fully understood by some of your colleagues. Feeling concerned about these observations, you decide to raise the issue during your clinical rotation debriefing session with your supervisor and fellow students. However, you sense some hesitation from your peers, and your supervisor seems unsure about how to address the issue effectively. And this leads us to our questions. For the first question, think about it from two different perspectives. First, put yourselves in the shoes of a nursing student in this current day and age. And then after discussion, think about it from your own personal perspective of what you would have done when you were a nursing student. So question one is, how do you navigate this situation as a minority nursing student, ensuring that the concerns about representation and equitable care for minority patients are acknowledged and addressed within the clinical setting? And then for the second question, I'm asking you to put yourselves back in the shoes of a current nursing student. And this is the question. What support would you look for from your peers, instructors, and faculty members in having dialogues that push DIB and anti-racism to the forefront, knowing these conversations may be uncomfortable to have? And then finally, for the last question, leaning on your own perspective and experiences, and based on your own identity, How will you support these conversations where current nursing students are starting these discussions in the classroom, clinical, or lab setting? And then I do not know how to do the whole breakout room thing, so.
I got you. We are going to break out and then we'll come